Hello everyone, I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. Our guest today is Dr. Amy West. She's a board-certified sports medicine physiatrist at Northwell Health Orthopedic Institute. She received her MD and Master's of Education degrees from Harvard University. She completed her residency in Physical Medicine and Rehabilitation at Harvard and then followed it up with the Sports Medicine Fellowship at Maine Medical Center. She is a professor at the Donald and Barbara Zucker School of Medicine at Hofstra University, where she also serves as the team physician for Hofstra. Her clinical focus not only includes non-operative sports medicine, but she also focuses on special populations, such as the female athlete, adaptive athletes, as well as transgender athletes. She herself is a former collegiate athlete, she's an avid CrossFitter, and she even holds a CrossFit Level 2 training certification. In this episode, we mainly talk about CrossFit. Dr. West dispels the myths about how CrossFit is overly dangerous and how so many injuries occur from CrossFitters. We then talk about her practice, and halfway through we take a left turn and actually talk about big food and policies and how doctors are kind of at a disadvantage when it comes to really trying to promote better health and wellness because of the policies that we have to abide by. Anyways, I think this is a fascinating conversation. There's a lot to learn from Dr. West, and if you're interested in following her on social media, all of her handles are at Amy West MD. Well, Amy, Dr. West, thank you so much for joining our podcast.
Well, thanks for having me.
Pleasure is ours. So, you have a lot of commonalities as far as your journey goes and your scope of practice with Altamash and I. PM&R trained, you obviously do sports medicine. One of the things that I think we do differently is that you focus your training on CrossFit, at least whenever you get the time outside of the hospital to work on your training. Mm-hmm. But take us through a little bit behind your background, why you chose physical medicine and rehab, because I think we all have unique journeys, especially when it comes to that field. And what got you interested in sports medicine and your current scope of practice?
Well, I've been an athlete my whole life. I've always been involved in sports. So it seems sort of like a natural kind of progression. I actually first learned about PM&R in med school. There was a lifestyle medicine interest group. And the person in charge of that was Beth Frades, who's sort of, I think she's the president of the Lifestyle Medicine Association group, that society, whatever it's called, but she's the president of it now. But at the time, it was sort of a newer thing. So I started talking to her, like, what do you do exactly? And then she ended up connecting me with some people in the PM&R department at Harvard, which oddly enough at the time, PM&R was kind of a very well kept secret there. I think I was the first person to go into PM&R at Harvard in it was like 4 or 5 years, prior to myself. Spaulding Rehab Hospital is this behemoth of an institution, but not many people know. Not at the time, not many med students ever even rotated there, knew it existed, knew what happened there. So I started looking into it right around after my third year of med school, and we don't rotate there. We had nothing to do with it at the time. So, and after my third year, I started. I did an education degree, a master's of education at Harvard. So I was sort of, I guess, in like an off year. So I started looking more into like what do they do over there at Harvard, so at Spaulding. So then I started hanging out there a lot and learning from the residents over there. And then it just so happened to be timed. It actually is quite timely now. The Boston Marathon bombings happened that year. So earlier that year, and I started rotating at Spaulding right as all of those patients who had amputations and traumatic brain injuries, and et cetera, from that bombing were being admitted to Spaulding for their rehab, and some of them were there for months and months and months after. But that was sort of my first kind of deep dive into rehab medicine and what it was, and I thought that was so cool. It was the most like uplifting part of their journey was finally happening at Spaulding. It's rehab is a place where everyone gets better. So that's like a really nice thing, as opposed to, regular hospital medicine where that's not always the case. And then I found during that year off, I found PM&R is, at the time at least, was kind of the best kept secret at Harvard. Not many med students knew about it. Not many med students rotated through Spaulding. I think I was the first person to go into PM&R in like 3 or 4 years. So it was kind of a very not many people knew about it. So I started learning more about it. I did a education degree after my third year of med school, so it was sort of like a year off, if you will, where I wasn't like in the hospital all the time. And during that time, I was able to hang out at Spaulding a bunch. And at that time, or shortly thereafter, was when the Boston Marathon bombings happened, and a lot of those patients who had lost limbs or had traumatic brain injuries and things like that, burn injuries, had been admitted to Spaulding for their rehab. So it was kind of a really interesting time to be there and to experience what PM&R was. A lot of those patients were kind of finally getting better and learning how to live their lives again. And it was nice to be part of something, part of a hospital where everyone gets better. And that doesn't always happen in regular medicine. So I thought that was really cool. And then after, around the same time, I was kind of looking, I would pass this CrossFit gym every day that was near my med school. And I said, one day I'm going to go in there when I have time. So I did. And I found that CrossFit essentially is the sport of function, and it bases its principles on functional movement. And PM&R kind of has the same feel to it, the same values. So the two actually align quite well. And it's certainly when it comes to the adaptive sport community and things like that. So I found both of them within like months of each other, and they just seem to work really well together. So now I spend a lot of my time explaining what one is to the other group of people. So it's, but I enjoy it, so that's good.
That's funny. Even now, you feel like with all the popularity CrossFit's gained over the last couple of years, you still have to.
Well, I think a lot of people think they know what it is, but they have no idea. I think that hence the misconceptions and the thoughts about it. The thoughts I usually hear tend to be negative ones, and they're usually based in nonsense, frankly. So, and a lot of people just don't,
Yeah.
or people don't realize kind of what it entails. So they assume it's only for certain types of people
Yeah.
or whatever. So I spend a lot of time dispelling those myths.
Sure. So let's do that, right? Like,
Yeah.
I'd love to hear your definition of it. The sport of function. I mean, that's awesome, right? They advertise as a sport of fitness. Although I don't know if they still do that. Do they still do that?
Yeah, they've had some rebranding sort of recently, but
Yeah.
yeah. But yeah, so I mean, yeah.
But what year was this, by the way, when you walked into Circa?
20 let's see, 2014, I think I started.
Okay.
2014, something like that is when I first.
So still relatively early.
Yeah.
All right. So sorry,
Yeah.
you were going to define your definition of for the layperson what CrossFit is. Somebody who doesn't know, lives under a rock.
Yeah. So I mean, CrossFit is not my definition. It's what Glassman defined it as, but it's constantly varied. So, using different things every day, constantly varied functional movement, which we can get into what exactly that is. Functional movement performed at high intensity, and intensity is relative. That's universally scalable. So, those four principles are actually principles of rehabilitation programs when you think about it. So, it's actually a scientifically backed methodology when you break it down. But yeah, so that's kind of what it is. It involves a mixture of endurance. So, you're running and rowing and things that require aerobic capacity, gymnastics, which doesn't necessarily mean like doing backflips. That means just sort of being able to handle your own body weight. So being able to move your body weight in space, which is actually a life-saving maneuver for people who can't do that. And then weightlifting, and weightlifting not in this traditional sense necessarily of like heavy barbells, although it can include that, but weightlifting meaning like exerting an external force on an object. So those are all important things that people need to be able to do in their everyday lives, which I think traditional training methodology doesn't necessarily mix. So people tend to stick in one of those boxes and stay with that, which has problems in and of itself. Then you're looking at the functional movement piece of it. So all the movements are based in function. So multi-joint, quarter extremity movements involving complex neuromuscular patterns. These are things that are presented to you in everyday life. So bicep curl is great, but it doesn't actually do a lot for you, as opposed to something like a deadlift, which is, people say, oh, I need to deadlift. Well, you need to pick stuff up off the floor. So how you learn how to do that is through practicing proper mechanics in a deadlift, whether you're deadlifting 500 pounds or an empty bar. So that's kind of how I frame it.
You mentioned intensity
Mm-hmm.
and how that's all relative.
Mm-hmm.
So for those who aren't familiar,
Mm-hmm.
what do you mean by that?
So, I mean, it really depends on, the workout, the person, what we're talking, like what kind of movements we're putting together. But in general, the things where you're reaching, elevated heart rates, and trying to do things quickly, I guess would be the sort of the most basic way to put it. Now, you see a lot now in literature talking about like high intensity interval training, which, sort of short bursts of energy followed by rest, and, or Tabata training, which is another thing that's used fairly commonly in CrossFit gyms. But essentially, you want to be raising your heart rate while you're exercising. I think there's that piece has been missing from traditional exercise guidelines for a very long time. I think just recently they might have added something about that. But for years it was saying just go walk, which has its benefits if you don't do anything. But as far as being effective, and then also as far as being time efficient, that's another thing about CrossFit. You're in and out within an hour, and you can do something for 8 minutes in a CrossFit gym and feel like you've gotten a workout. Which I think for people, especially like busy people like we are, it's just time efficient if nothing else.
Yeah. I might even add on to that, like it's a lot of physiological strain
Mm-hmm.
if people think about it, right? So if somebody's going for a 1 rep max, you might not skyrocket the heart rate,
Mm-hmm.
but you will skyrocket your blood pressure.
Mm-hmm.
Like it'll be like 300 over 350 over 250 or something like that, systolic and diastolic. So
Mm-hmm.
that's another way that I like to look at it, because it could just be an absolute, max that somebody's going for.
Right.
Although I think that those are probably few and far between for kind of what you're describing.
Mm-hmm.
I know Darsh had a follow-up question for you.
Yep.
I'm curious about the training schedule, right? So I'm assuming people who listen to this podcast are probably also listening to Huberman, Atia, right? And they recently had Dr. Andy Galpin come on. And I don't believe he actually talked about CrossFit when he was going through different training schedules, talking about speed, endurance, strength, anaerobic, etc. And I'm assuming in CrossFit too, right? You have professional
Mm-hmm.
athletes, but then you also just have your regular day goers, right?
Mm-hmm.
Can you take me through just like a week
Mm-hmm.
long training schedule for each?
Mm-hmm.
And then are there also quarterly goals, for example, or monthly goals that the professional athletes will go through to isolate one of those specific attributes, whether it's like speed or strength, et cetera?
Yeah. So I listened to those podcasts with Huberman and Galpin, and huge Huberman fan myself. It's funny because a lot of the things that they were talking about, they were talking about CrossFit without saying the word CrossFit. And it, as far as like taxing different, levels of intensity, taxing different parts of the body, taxing at different, encouraging different types of movement. And it was just like I felt like reaching through the screen and being like, "No, you're talking about CrossFit actually." But what's really nice about CrossFit in general is that you show up and they tell you what to do and then you go home. So for someone like myself, at least when I started, and for your average person, you don't have to like. There's not a lot of thinking involved as far as like what should I be doing today, what body part am I working out or whatever. It's like you show up and they tell you what to do and you do it. And any good CrossFit gym will have someone in charge of programming who's programming things very specifically to such that every day is different, but it's not random. It's deliberate difference, if you will. So, there's a day where the workout might be 20 minutes, involve 800-meter sprinting and pull-ups and cleans or something like that.
Hmm.
And then the next day, the workout might be, 5 minutes of, you know, something, something out like just max squat and some kettlebell swings or something, and every day it's different. And every day the time domain's slightly different. The skills being tested are slightly different. And because CrossFit's in like an affiliate system, it's not like a franchise. So every gym kind of operates independently of each other, and they have their own programming, their own way of doing things. A lot of gyms will have like a lifting component, like you walk in and there's either a skill that they're doing of the day, like a gymnastic skill, or a lift, like a find a 3 rep max of a squat, and then followed by a workout, which usually rarely goes over 20 minutes, but sometimes, some days there's longer ones, some days there's shorter ones. So, but it's all very deliberately programmed. But every gym does it slightly different. But the whole idea is that we can all show up and then do the same thing, except how that looks might be different for you versus me, or like for grandma versus myself, because everything's scalable. Every movement has kind of progressions that lead to it. So instead of doing pull-ups, you might be doing ring rows, or you might just be doing another kind of pulling movement, somewhere else. So it's not everyone is not expected to show up and be at the same level, and that's the beauty of it.
Right. Gotcha. Now, is there an expectation that you're showing up to the box every day, or because I think when I look at the pricing, it's like based off how many days
Hmm.
per the month you go usually. So,
Yeah, and again, that's like very different based on the gyms, but I
okay.
mean, the idea is that you're there, probably 4 to 5 days a week, but whenever you can, I guess. But every gym has pricing. The prices are all over the place. The packages they have, they all do it independently.
Yeah. So, the whole idea of exercise being medicine,
Hmm.
right? I mean, AMSSM has really taken, you know, that concept or that phrase and been really pushing it a lot over the last couple of years. Obviously started in the American College of Sports Medicine, but it's also infiltrated in AAPM&R. Like every
Yeah.
conference that I go to, there's a separate maybe track for that almost. And I think all of us are a little bit biased, but the data clearly suggests that it's almost better than medicine, right? There's
Hmm.
there's really no medicine that's going to affect as many systems in a positive manner as much as exercise will. That being said, though, the type of exercise matters, certainly the intensity, all the things that you've talked about. Now, one of the things that I think you recently retweeted or posted, I'm not sure, it was something on Twitter, is that somebody talking about how CrossFit's going to quote unquote keep you in business, right? You're a physiatrist,
Ah,
you're a sports
yes.
medicine
I
doctor,
love
so am
that.
I, so is Darsh.
Yeah.
So I'd love to maybe touch on that piece of it. That's something that sounds like you hear quite often, maybe in discussions with your colleagues. You're clearly very passionate about it. What's your take on that? Maybe elaborate for those who don't know exactly what the heck people mean by keeping you in business.
Ah.
And then, like, where did that come from? Like, that kind of stuff.
Yeah, so I hear that quite a bit. People say, "Oh, you're in orthopedics." Oh, well, those CrossFitters, they're always getting injured. That'll keep you in business. And I love when people say that to me, because, well, one, what actually keeps me in business are sedentary people who don't move their bodies. So at the end of the day, most of my schedule, people with arthritis, people who are not such great shape, who injure themselves putting their pants on. So that's what's in our like healthcare system for the most part, right? And then, that being said, I I say to that as well, these are problems of fitness, not problems of sickness, right? So if someone tears their rotator cuff trying to do a pull up or something, I, as a medical provider, would much rather deal with that problem, or have the luxury of being worried about that problem, than all the actual problems that exist in our healthcare system, the people who are getting sick with chronic disease from not moving. So that's part of it, is that, that people who want to take shots, or say things like that, usually, I can pick that apart pretty quickly. Then beyond that, there's been studies that have shown that, active people are more likely to get active being active, and sedentary people are more likely to get injured being sedentary. So, I mean, by doing these little things, in their household, how many times have I seen someone I was picking up my kid, and my back started hurting. I was putting something in the dishwasher, and I sneezed, and I can't move my legs now. I mean, this is stuff that I see all the time. And in CrossFit, you're actually drilling those movements and learning how to do them properly to prevent yourself getting injured when you do them in real life. So it's actually the exact opposite uh, of the scenario. I mean, certainly accidents happen, and I think, you always get knuckleheads who will try to, I did 6 workouts today and now I'm hurting myself. Well, yeah, I mean, that's going to happen, and accidents happen, and weird things happen, but the amount of people that are having their lives saved by being active and doing things like CrossFit compared to the amount of people getting injured, I don't think it doesn't compare, in general. So and then, like I was saying before, the principles of CrossFit, like I was talking about before, are all actually scientifically backed injury prevention programs. So when you break it down, it actually, I would argue, prevents more injuries than it causes. So when people say stuff like that to me, it's like, okay. And then I usually take it from where it comes. So, I tell people, and I see a lot of CrossFit athletes in my clinic because they go to someone else and they'll tell them, you shouldn't, oh, don't CrossFit. You shouldn't CrossFit. It's dangerous. And what's funny is I say to people, I said, look at the person who told you that. And if that person looks like they know what they're talking about, then ask them what they do and do that. But 9 times out of 10, it's somebody who's got no business commenting on your fitness. So, so that's usually
Yeah.
what I say.
I'm going to play devil's advocate for a second,
Yeah.
because I think maybe if I rewind the clock 10 years ago, so I mean, I spent right before going to medical school, I spent some time doing performance coaching, working for Pre-C Speed School. And then within our facility, we started a CrossFit gym, or the owner wanted to start a CrossFit gym. And I didn't take these shots keeping you in business. I didn't do that. But I was one of those people putting those memes up saying, okay, like, I'm just getting good at exercising and this and that kind of, because, you mentioned you're an athlete, right? So you're always training for something, right? You want to throw farther, you want to hit harder, you want to run faster, et cetera, et cetera. And I was, the common, the easy low hanging, fruits, or in terms of jokes, was like, okay, look, we're just exercising for the sake of exercising. But over the years, what we've seen is, I would say, the bad actors, the bad players have kind of just fizzled out, and the people who are doing or those principles that you've talked about, and implementing the good practices, they've really shined. So basically, if you something that Darsh and I were talking about offline is like, I don't know if this is maybe from like the CrossFit and affiliates, or just kind of just people not being able to hang because of bad practice over time. But it's like the weeds have just kind of died over time because the flowers and stuff had been watered, and whether CrossFit's given them the resources, or people just, the good people have been separated themselves from the pack. But the issue was that when we look at other sports, basketball, football, some of the other popular sports in this country, baseball, I think the average individuals sees that athlete, that elite athlete, and recognizes that there's a gap between themselves, LeBron James, right? Like, they're not going to go, or like Tom Brady or whoever it is, and they're not going to go play tackle football and expect to be okay. But then you watch Tia Claire Toomey, you watch like all these, God, what's the hard work pays off? I can't think of
Matt
it.
Frazier.
What's his last
Matt
name?
Frazier.
Frazier. You watch Frazier a couple times, right?
Yeah.
And you watch all these people, and then you have access to everything that it is that they're doing, right? And so you watch.
Hmm.
I mean, some of my favorite documentaries ever to watch is when they do the CrossFit Games, right? Like, those three things, they just get me so juiced up. And
Yeah.
you see the
Yeah.
workouts, and you can easily, that's
Yeah.
accessible to you in the gym. You have all those resources to do that. But what you fail to realize is, you are not Matt Frazier. You are not Tia Claire Toomey. You are not Catherine, and that's how people accumulate some of these injuries,
Yeah.
right? And yes, I love how you said that they're injuries of fitness, not
Hmm.
necessarily of, what was it you said? Sedentary
I mean,
injuries of
they're fitness problems, not, health problems. Problems of
health
sickness.
problems. So, yeah, I like that.
Problems of sickness.
Problem sickness.
Yeah.
Yes, that's what it was. Yes,
Hmm.
I want to make sure I write that down.
Hmm.
And that's certainly, as a sports medicine provider, I mean, that's something that's favorable for us, right? I think overall, what we've learned is, over the last 10, 15 years, as long as CrossFit's been around, it's been a net positive, right? When we talk about the camaraderie piece of it, people engaging and social connection. As we realize, we talk about longevity and all those kinds of things.
Yep.
Exercise is certainly good, but so is longevity. So is all these other practices, is because when you engage in exercise, you're going to be talking about your Whoop data, your HRV, your sleep, all that kind of stuff, right? It all comes in together. And so overall, when you consider all those things, I think there's no doubt to me that it is a net positive. But I want to
Hmm.
put you on the spot here for a second. You've been
Yeah,
such an advocate for it since we started
let's
chatting.
roll. Yeah.
What is it about it that you don't like,
Hmm.
right? What are some of the negatives, pitfalls, things that do concern you that could be better?
Well, I think there's and it sort of speaks to what you were saying. There's CrossFit the sport, and there's CrossFit the methodology and the training,
Mm.
and those are not necessarily the same. And it's just like me watching LeBron James and then trying to dunk a basketball. Like, it's not going to happen for me. So I'm not going to try it, you know? So like, there's that part of it where I think some people kind of confuse the two. And that's, I think part of the reason that, a few years ago, there was some kind of downplaying of the games from a corporate level of CrossFit, because that's not really what CrossFit is at its base. So I think that that kind of adds some issue, with people seeing that on TV, and then people going out and trying to do some of those things, or not. For me, it's more that people think you have to be that level to engage in it. And I think there's still so many misconceptions about who can walk into a CrossFit gym and get something out of it. I mean, I just took two friends of mine last week for their first time, who are not necessarily exercisers, and they were like, their minds were blown as like, oh, this was not at all what I thought it was going to be, and they actually really enjoyed themselves. And it's stuff like that where I'm still working to kind of change that in people's minds, but I think there's definitely a lot of misconceptions that exist for whatever reason, whether it's marketing or whatever, that people kind of need to break down. So I think that's definitely part of it. I think also this idea that it's dangerous. I mean, I was recently at a hotel gym, and the things I saw people doing in there were pretty scary, frankly. I mean, when people are left to their own devices to kind of just do stuff, it was actually kind of a little bit worrisome. So I can see someone, in their garage trying to like make something up and do it on their own, and that can be a problem if you don't have a good knowledge of what you're doing or how. But that's universal. That's not a CrossFit problem. That's a problem. And I think because people who tend to gravitate towards CrossFit tend to be sort of competitive people, you can get some egos involved in doing things that maybe you shouldn't be, or things you did back in high school that you haven't done in 20 years, and then you hurt
Right.
yourself. So there's certainly those things that happen.
For sure. I just want to throw out some numbers there. So, recent guest of ours, Dan Pope, he has the account Fitness Pain Free. He actually wrote about the risk numbers when it comes to CrossFit, right? So he says CrossFit has a
I think I sent
relatively
that to
low
him.
injury. Oh, did you? With the okay. So I'll just
I
say it
think
out
so.
here for the
Yeah.
audience at least.
Hmm.
0.27 to 3.3 injuries per 1,000 hours of participation, right? So I think if you take someone training about 4 times per week, and let's say they do an hour, you're talking about 0.27 to 3.3 injuries for every 5 years of participation, right? And this is actually from a study from Gardner in 2020 in the Journal of Sports Med. So yeah, relatively low injury. But I guess my question too is, what type of injuries are we seeing in CrossFit athletes? Are there any
Hmm.
specific joints that or muscles that we see get affected
Yeah.
more?
Well, yeah. So, I mean, just to piggyback off of that, when you look
Yeah.
at running injury rates, it can be up to 12, 13 per thousand hours of training. So when you compare the two, actually, they're not even close. But as far as injuries that tend to happen, I mean, big thing: shoulders, knees, backs. A lot of people, like in CrossFit, there's a lot of like pulling, like body weight pulling and stuff like that. I mean, obviously, it could be adjusted based on your level, but people getting impingement and some rotator cuff stuff going on. Um, there's a lot of, with any weightlifting, lumbar spine issues certainly can arise, especially like heavy lifting. It's just kind of natural. Things like that happen. And then, less so knees, some knee injuries here and there. Or, if people who have a lot of times also we're seeing like people have like old injuries and they kind of stir them up again. Something I see a lot of is that people using parts of their body they have not used in a very long time, which speaks to the fact that they need to use them, but then sometimes they start hurting as a result. So people sort of waking up things that they haven't used in a while.
All right, let's talk about coaching.
Hmm.
You recently tweeted that you got your CF level 2.
Hmm.
And if I remember correctly, it's in get 4, right? You get 4 level
Yeah,
certifications.
there's
Is
up
that
to an
correct?
L4. Yeah, it's not that many people are L4s, but yeah.
Awesome. What was your inspiration for this?
Hmm.
And I'm curious how this has helped you in your practice, or like what was the reason for this?
Well, I'll start. I got my L1. I actually got it during that kind of year that I was off. I decided to get my L1 because I was super into CrossFit, want to learn more about it, and it really kind of helped lay out the methodology, and I really thought it was very interesting. Not long after that, I actually got an email from the founder of CrossFit. So Greg Glassman had reached out to a handful of doctors that I had done a grand rounds at my hospital about CrossFit, and I guess he got wind of it. And he invited a group of doctors out to CrossFit Ranch out in California for this L1 for just doctors, and actually met a lot of people there. It was really cool. And then recently they just started doing the L2s for physicians. So I was part of the first one of those. And the L2 is really interesting because it's a lot about teaching, the art of teaching. And I'm someone I have an education degree, and people say, "Why did you do that?" And I say, "As a physician, you are a teacher, whether you want to be or not, right? I spend all day explaining things to people, not to mention the residents and the med students that you work with as well. And almost no one in medical education has any formal education training, which is kind of crazy when you think about it. But as just someone who teaches, whether it's via something like this or social media or in the clinic, it's really important to have some basic skills of how to communicate clearly and effectively to people so that they understand. And the L2 actually is really about the art of coaching slash teaching, and they really help you learn how to break down movements and teach them such that a group of people can understand it, and also how to kind of manage multiple kind of levels of people at once. And it was crazy to see in a room full of doctors, like how many people could not do it well. Could not do it well. They're talking too much, they're saying too much, they're not just demonstrating things, they're not being clear. But the way I saw it is like, if you're teaching a squat, there's very similar principles can be applied to when you're teaching someone how to like ultrasound a knee. I mean, it's like, okay, this is what we're doing. Let me show you. Here's step one. Well, it's kind of basic when you think about it, but it's actually not something that we drill a lot as medical professionals, where coaches, like a good coach has that down.
Do you mind going into some of those details or tactics that you've learned? I'm super interested in coaching. Actually, I plan on either getting like a life
Yeah.
coach or performance coaching certification. So, any tactics that you have for the
Yeah.
listeners when it comes to effectiveness?
Well, I mean, the thing that was really that struck me was like, you want to, as far as like, when you approach a group of people, okay, this is what we're doing. Like, be very clear about what your intention is, demonstrate what you're doing, and then keep it simple, because it was crazy to see how many people would just start talking and it was just like word vomit. And like after a while, no one's paying attention, everyone's confused, and taking it step by step, like very much like breaking down, here, we're going to do this, boom, okay, now show me that, okay, next step, okay, we're going to do this, boom, show me that. And I've found some very similar kind of things with, when I was trying to learn ultrasound, and like, someone would get up there and say, okay, here's the ultrasound of the knee, and like ultrasound the whole thing, like, okay, you guys go. And everyone's like, wait, what? So how do I hold this? Like and it's the same idea, is like breaking it down step by step, having people demonstrate that they understand and can show it back, and then kind of advancing, in sort of like the most basic way. But keeping it simple I think is the hardest thing, but also the best way to kind of communicate your message.
Yeah, it's the KISS principle, right?
Yeah.
I tell my students and residents all the time. I'm like, when you're so recently, I've been having my students create the home exercise programs,
Hmm.
like just use Hep2Go, free resource for everybody, for my patients, and then I'll review it. And then, some of the ones who are really, really enthusiastic and train often, they'll start like what they used to train for themselves. They'll start putting these like programs with like 9 exercises, 4 sets, like reps, and I'm just like, all right, this lady has knee osteoarthritis and has like 70 pounds to lose. Like she can't do the program that you're doing right now.
Right.
And I always tell them, like, look, when it's too simple for you, it's too complicated for them, right? So simplify it even more and more and more. Um, and so what's also interesting is, like, when you are a medical student, like when you're doing your clinical, like, practice things your first or second year, at least I recall in my medical school, is one of the good things that is, they always, you would tell the plan, right, to the simulated patient that you had. You want to make sure that they understand, and you're like, can you repeat the plan back to me? And oftentimes, if you actually do that in clinical practice, it's very rare that the patient will, point by point tell you exactly what it is that you tell them. And yeah, it's very challenging for physicians to not just word vomit, show it what it is that we know, just demonstrate our knowledge, right?
Yeah.
It's kind of the ego thing that Darsh, you and I talk about all the time. And so, yeah, I mean, this is something I think all of us share this passion about coaching and the art of coaching. So a couple of resources for people to plug in is Brett Bartholomew, great podcast that he has, a couple of books, I think, that the art of coaching. Martin Rooney has a lot of good things, but all these things, people come from, fitness and training and performance, things that, you know that they have value, and that's why you sought that out. Was this before or after kind of like the low carb, was it low carb diet
Oh, Lord
conference?
from Denver,
And then
yeah.
when you were at Monarch, you were
Oh, you know
low carb
what? It
Denver.
was it
Okay.
was a bit of a blur of a month. Yeah. Yeah, I was all over the place for like a month and
Yeah.
a half.
It
Yeah.
almost seemed like you were like on this trip going to all different types of places. Tell me about that.
Yeah.
Like, was that intentional? Were you on vacation? What was going on?
Somewhat. So I initially, with the low carb Denver conference, I just sort of, I don't know how I sort of on the social media or something, and then I just like saw all these speakers that were going to be there. That was like, oh, that person's interesting. That person's interesting. That person, is, and I was just like, I got to go check this out. So it's actually really cool. About yeah, and it was again like just being surrounded by people who were like prioritizing fitness and nutrition, and there are sort of varying degrees of like how in the weeds you can get with some of these things, but overall the idea was that, hey, like we're all on board here with like people need to eat better and people need to move more. Like that was sort of like the ultimately like the discussion that was had, and looking at metabolic health as one of the main underlying causes of most things that we encounter. I say like, and people forget that that musculoskeletal health, like that metabolic health, is so intertwined with that. I mean, ask 99% of people with diabetes have back pain, like they just do, because they go hand in hand, right? So, and things like arthritis burden and stuff like that, it's all tied to things like obesity and nutrition and stuff like that. They can all help. It can all be improved by improving nutrition. But while I was there, I met some really interesting people, and everyone's sort of like on the same page about like things like protein intake and stuff like that. But also one of the biggest things that I think was really important about that conference that I learned more about was looking into the influence of food and big pharma in our governmental recommendations, and how it's pretty scary actually when you see just kind of how like Heinz and Kellogg's are influencing dietary guidelines, which are then trickle down to people in the military, people in schools, people in jails, people in hospitals. These guidelines are being used across the board, and you see how flawed they are and how influenced they are. It's really scary. It's a big wake up call, and I think part of what drew me into the CrossFit space was that CrossFit was sort of very anti-establishment, meaning they had worked really hard to expose the ties of the big sports medicines associations with essentially Coca-Cola, and how Coca-Cola essentially influences dietary guidelines. They're one of the biggest sponsors of the Exercise is Medicine campaign, which most people don't know.
Hmm.
And there's a reason that Coca-Cola has an interest in shaping those guidelines, and it's to steer people away from their product as a cause of obesity and diabetes and et cetera. But to point it as, oh, it's not that you drink this, it's because you don't exercise enough. Let us tell you how to do that. And that was a really interesting thing for me to learn as a med student or resident or whatever it was at the time, and to see just how many of the big sports medicine, but a lot of the medical societies are funded primarily through these big food, big pharma companies, which is kind of scary. And most people don't know it. And that's why at the ACSM, when their biggest sponsor is the Gatorade Sports Science Institute. That's Coca-Cola is running that conference, and that's there's a reason they are. And I think most people don't even realize it. And I think when I talk about it, I think people sometimes are like, I'm not implying that like everyone there is like taking money from Coca-Cola to like put out bullshit research. I'm saying, but it's happened. And actually, there was a big lawsuit. A lot of the anti-CrossFit sentiment is actually originated to be that was actually CrossFit sued the NSCA over false data that they published intentionally to discredit CrossFit for this reason, because CrossFit was shining a light on where they were getting their money, allegedly. I don't know. I wasn't there, but so and it was actually a pretty big case, because also the way CrossFit trainers are certified is not through the NSCA or the ACSM, which is a big money loss for them, right? So they actually tried. There were a lot of bills passed. They were trying to outlaw CrossFit in some states. There was bills on those senates to outlaw CrossFit because they were saying they're training people illegally and they're putting them at risk of injury. Here's the data to prove it, which we doctored. So it's actually really it's a pretty crazy story when you follow the bouncing ball. But and unfortunately, when CrossFit Coders changed ownership, that case was settled out of court for an undisclosed amount. But really, CrossFit had the NSCA by the balls. But now it's all been buried, and no one knows what really happened with it. But really interesting stuff. But getting back to the influences of industry on medicine is one of the big reasons that we are in the crisis that we're in right now with metabolic health. And when you look at obesity rates over the past 20 years, they've tripled or whatever it is. But someone said that's not by accident, that's by design. The food industry designed that. We should be pissed off about it.
So recently, social media, there's been the Tufts food pyramid, not necessarily a pyramid, but a graph at least showing the quality of foods.
Mm-hmm.
And you guys may have seen this. It's the green, the yellow, and the red bars. And, you're talking about big food, and it's insane that they would rate frosted mini wheats higher than eggs, right? I think frosted mini wheats was like the third or fifth, like highest rank in the green. And then eggs was kind of down below in the middle and that in the yellow. And so, this is absolutely confusing to the U.S. public. You think Tufts University, you would say, oh, great university. This is probably academia. This is probably based off research. So, I mean, it frustrates me so much. And again, we were talking offline, like this is why Altamash and I also kind of started this podcast, right? It's like anti-establishment in a way. And I was listening to Adam Grant, actually podcast, Altamash, you may have heard this. And he talks about one of the best ways to convince people to do something, especially the younger generation, is to tell them that it goes anti-establishment. So I found that interesting. And, you learning about that, you seeing these at these conferences, hopefully sparks hope, but it seems like, it's a lot of the intellectuals having this conversation, and hopefully we can get that passed down to more of the lay people who, really don't have true understanding of how research happens or what's going on behind the scenes.
Right. And I think that's a big problem with, we can't change people's fitness and health if the guidelines that are there being given and that they're trying to adhere to are based in either questionable data or have questionable influences. So I think that's what's the really frustrating part, is because those guidelines exist, actually people like us who say, no, you should eat the eggs instead, we're actually against standard of care, right? So then actually we could be held accountable for that because we're going against what the guidelines are, which is what's crazy. So I think that's also part of it, is just like, it's hopeful in a sense because people are talking about it. It's also really daunting because there's so much that needs to change, or at least needs to be exposed so that people get it. And there's not that many people who are interested in learning, to be honest. So it can be quite difficult sometimes.
Yeah, it gets really messy when people start propagating advocacy and disguising it as science, right? That's kind of That's kind of what happens in social media and really everywhere else. But I want to talk about some of the other things so I saw you Exos, right? Anybody who follows fitness understands the legendary facilities that Exos are. You were at Monarch Health, or is it the gym that on the West Coast? I follow them. I've been following them for a long time.
Hmm.
They do a lot of cool things as well. Where else did you go on your trip, and what were some other key lessons, maybe some coaching stuff, that tactics you brought back to your practice, things that we could employ and do a better job talking to our patients, communicating with our colleagues, that kind of
Yeah,
stuff?
so something that I so I went out to visit the guys out at Monarch Athletic Club, which people don't know. It's basically sort of like a concierge medical practice in a way. So basically, people pay a monthly fee, and for that monthly fee, they get primary care visits, they get personal training sessions, and they also get physical therapy sessions. And I believe it's unlimited for those things, but I'm not 100% sure of that. They're also getting some mental health professionals there. They're also involving nutrition um, advice as well, some recovery tools as well. So it's a really cool model as far as healthcare, because it's actually, to me, what healthcare is. It's involving all of those things. And when someone shows up there, they have their evaluation with Dr. Green. They're also then, beyond that, then they're sort of given a step-by-step plan of here's how to change or fix or improve the things that we found. And I think that's the kind of the piece that's missing, is that it's easy to say eat better and exercise more, but like most people are just going to say okay, cool, and then that's it. Whereas here it's like here's a plan how to do that, and here are the people that will show you how to do that. And I think that's a really important thing, is not just giving people advice, but then leading them to people who can help them. And that's part of the reason why I'm such a CrossFit enthusiast, because you can sell someone an affiliate and say, okay, and they will tell you what to do. Just do it. You don't have to think about it. You don't have to come up with something. They'll just come. Will guide you on what to do. And then another thing that was interesting about that too, and similarly at Exos, is that part of their health screen involves a movement piece. So, people go to their primary care doctor and they get, the blood work, and it's usually pretty cursory blood work, and they get weighed or whatever and say, okay, well, check the boxes, here you go. But something like having some kind of fitness assessment or movement battery to say, okay, this is how you're doing physically, and we can do this again in 6 months and see and compare the two. I think that is actually way more useful than a lot of the blood markers that you get. And something that I do every year, the CrossFit Open, is it's basically a yearly physical fitness test, and every year you kind of see where you stack up. And it's an indication for you to see, okay, what am I need to work on, what have I gotten better at, what have I gotten worse at. And I think that movement piece is super important, and movement screens are super important, at the most basic level, which is something that's kind of missing from our sort of annual healthcare model.
You read my mind, because that's exactly where I wanted to go next. Talk about your annual checkup, right? Because you recently posted about this again on social media. It almost sounds like I've been stalking you, but really, it's just good
Yeah,
research, I
it's all
promise.
good.
Um, talk a little bit about your annual checkup. What does that entail? I know you do some blood work, some actual testing, objective
Yeah,
measures.
so like I was saying, I always involve some kind of fitness piece of it, and for me, it's the open. But if you don't do that, there's different things that you can do. Like even if you run a race every year, comparing your times year to year, or I think it has to be in sort of multimodal fashion. So not just an endurance piece, but like things like weightlifting and gymnastics in the more kind of basic term, in those terms, what they mean more basically, to see how you're kind of stacking up year to year. What's nice about the open is that you can kind of manipulate the board such that you can compare people your age, your gender, your where you live. You can kind of really break it down to compare yourself better. But something like that, I think, is super important for people to add as part of their yearly checkup. Another thing that I did this year was a DEXA scan, and not sort of like a bone density test, but kind of more full body. And it looks at things like, muscle mass, bone density, visceral fat, which is something that's super important that I think a lot of people are not aware of on their body, but also how important it is to keep that number low. Side to side comparisons, things like that, so that was really informative. And I think if you don't have access to that, there's in-body scans, which are a little bit less, they're less, there's no radiation with those. They're much less, more easily accessible. But something like that. And I think having those numbers, or, knowing what your body fat percentage, something like BMI is like, to me, a very kind of useless number in most people. So having a better sense of like your muscle mass and your body fat percentage and your visceral fat, knowing those numbers is super important. Especially, sarcopenia is a huge problem, in most people as they age, and they sort of dwindle over time, which is, you take care of your muscular system, muscular health, and the other systems will follow. So really emphasizing muscular health, I think, is very important in preventing weakness, preventing disability, but also promoting overall health. Because you look at people in nursing homes, none of them are ripped. There's you lose that muscle mass there, and you will start to suffer the consequences. So I think it's super important, especially for women, because I don't think we're told to think about that very much. So super important to keep track of that and to know that number. And then, yeah, some blood work, some basic blood work beyond kind of the traditional stuff that's checked in doctors' offices, especially when you get into certain like lipid numbers and hormone profiles. I think it can get kind of nuanced, and I'll say most primary care doctors don't really go into those things. So there are certain companies that you can buy lab work from and stuff like that who can go into it more, more detail.
Yeah, for sure. I do want to ask you about your day-to-day. Are you wearing any technologies or using any wearables?
Yes. Well, at the moment, I have 3 on. So I have a Whoop, an Oura Ring, and an Apple Watch. So I'm a bit of a data nerd, but I also have an 8 Sleep on my bed. So
nice.
So I'm tracking myself all the time. But so I started wearing a Whoop back. They started. Their company, I think, might still actually be based in the building I lived in.
Okay.
So they started the company. It was like a small company in Boston at the time, and our CrossFit gym was right next door. So they would like drop off like free promo material and stuff. And at the time, you could just buy one. It wasn't a monthly thing. So I got into it then, and I've sort of had one ever since. And working on possibly some research things with them and stuff. So so I'm just most familiar with that technology and how it's evolved over the past X amount of years. And then I have this Oura Ring. I can't work out with it though. So it's kind of its utility I'm still figuring out. And the Apple Watch, same thing. I don't work out with it because it's just like too big. So, but yeah, so I just sometimes like to compare the numbers and say like, sometimes it'll have the same number, same kind of HRV, and give me like totally different explanations for it, or totally different recommendations based on the same number. So I just, it's interesting.
Oh, okay.
But
I was going to ask you.
It's more just for like, it's more for fun for me. Yeah. For me, it's more like nerdy fun stuff, which,
Yeah, I got to know, because I have an Oura. Darsh does the Whoop for sleep purposes. I want to, how long have you been wearing the Oura Ring?
I think I got it around like Christmas time. They were having some kind of promo, so it must have been around then.
This past Christmas. So a couple months in. Have you been wearing consistently?
I have been.
For nighttime?
Yeah, I have been.
What's for sleep tracking? What have you found to be better? I know it's an N of 1, but for you,
I think as far as like the numbers it gives me, they both kind of give me very similar data. I found that the Oura Ring is much more optimistic about what that means. So, but part might be just because it doesn't know me yet, so I don't know. Whereas the Whoop I've had for so long that maybe it's some algorithm is adjusted to my life in some way. Whereas the Oura Ring, it usually tells me I'm more ready than the band does.
So based off Huberman, I think he actually said the 8 Sleep is the best thing to use, even for HRV, for sleeping, just because the way it monitors. But I still use my Whoop because I don't feel like putting in 2 different journals into the 8 Sleep as well as the Whoop. But the 8 Sleep apparently alt, so that's next on your list. And it's wonderful.
I mean, so so I have one, and I haven't like, I don't like check the numbers very often. I just like the fact that it changes temperature and stuff when I sleep, so I enjoy that. And I was talking to Kelly Starrett, who's mentor of mine, and he has a similar kind of bed thing that he uses, and he swears by that. So, so yeah, I think we're all getting some similar information. Sometimes it's good information, sometimes not, but I'm still trying to figure it out.
Yeah.
Love it. Well, Amy, this has been a lot of fun. I realize that we certainly got to get you back. I mean, there are so many different places that we can go, topics that we can explore. So hopefully you'll be down to do that at some point. But before we let you go, I certainly want to ask, I mean, you've got so much going on. We barely talked about your clinical practice. You're a team physician. You do a lot of great things. You talked about some research projects that might be on fitness, that kind of stuff. You recently got your L2. What's next for you? What are you excited about over the next couple of years coming in, sports med? Maybe you and I, hey, maybe we'll run into you next week. We should
I'm actually presenting a case about
the conference,
presenting a case about something we saw at the CrossFit Games last year. So it was a pretty interesting case. It was a public knowledge, so the person knows that it's being presented. So what am I doing the next couple months? So well, you can follow my adventures on Twitter and Instagram at Amy West MD. I actually I edited and wrote part of a textbook that's coming out hopefully this summer about transgender athletes. So that will be hopefully out soon. That topic has become a bit of an electric fence recently. It was not when I started being interested in the subject. So, but anyway, that's coming up soon. Continuing to work with CrossFit Health in sort of in the periphery, but we're actually going to have we're starting these like grand rounds where people can tune in and learn about different health topics sort of through that lens. So I believe next month I'm going to be giving a grand rounds, if you will, about so similar to what we talked about CrossFit being dangerous. Is it not? Here's the literature. And then, yeah, I'm, always doing something. So I put it on my social media and happy to connect people, working some adaptive athlete projects as well, adaptive CrossFit projects with some people in South America, and working on hopefully using a wearable device, looking at some female athletes that we have here at Hofstra. So hoping to get that off the ground sometime soon.
Very cool. Everything sounds very interesting. So I know Altamash and I are definitely excited to keep up with you. We'll, definitely on your socials, which we will link in our show notes.
Mm-hmm.
You've also got a podcast though. Tell us a little bit about that.
Oh yeah. So my friend Matt Cowling, who's a physiatrist himself, and he's in Wisconsin again these days. We actually met at the CrossFit L1, however many years ago that was. And we've met so many cool, interesting people who are doing interesting things in the fitness and medical space. So we interviewed them on a podcast called Docs in the Box. You can find that on Instagram. We've been putting out episodes for a couple of years now. So we always have people who are doing cool stuff on there.
Awesome. Well, Amy, I just want to thank you so much. Your range exceeds more than, just your titles. You definitely do a lot. You spoke on big food, big pharma, fitness, and everything in between. And the last question we have for you is, how do we add the health back to healthcare?
Wow. I think it starts with, I guess, there's sort of two things. One is by being healthy yourself as a physician, which I think a lot of people don't prioritize. Mm-hmm. But two is, I sort of guess going with the name of the podcast, is sort of redefining what health is. I think we have some influences in there who are telling us what health is, and actually there are other metrics that we can use to examine health, but then also to improve it, and educating yourself as to what those things are can at least help start the ball rolling.
For sure.
Beautiful. Thanks, Amy.
Thank you.
Thank you so much for taking the time to listen to this episode. If you are interested in getting into CrossFit, I highly recommend following Dr. Amy West on all of her socials. She has great content, very inspiring, and I think you guys will take away some lessons when it comes to being in the box. Make sure to follow her podcast as well. And as always, if you enjoyed this episode, make sure to share it with someone who you know will benefit as well. Please do us a huge favor and take the time to rate and review our podcast. Every rating, every review helps us to spread our message to all the other potential listeners out there in the world who are looking to get great content. As always, the disclaimer, everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, and we are not providing medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of our personal physician regarding any specific health-related issues. And lastly, thank you to our team for the production of this podcast, Ethan Ju and Haritha Yepuri. Until next time.